Today I would like to share my experience of being without health insurance. Perhaps some of you in the audience can relate, or maybe you cannot. We all need to understand the problems that are associated with being uninsured, so we can fix the problems that exist and make the system work better for everyone. I've been a licensed cosmetologist for 27 years. I own a salon in Union Springs, New York, and I'm a longtime volunteer for the American Cancer Society's Look Good, Feel Better program here at Auburn Memorial Hospital. Look Good, Feel Better pairs cancer patients with cosmetologists who in turn help them temporarily exchange the challenges of treatment for a little pampering. In my experience, I have seen firsthand what cancer can do to a person. Last year, I personally came face to face with the possibility of having cancer myself. Being self-employed as a business owner, I am unable to receive health benefits through my job. For several years, I was able to take advantage of the Family Health Plus through the state of New York. 2 years ago, I got married, and our combined income put us over the limit income for Family Health Plus by just a few $1,000s a year. I was eligible for limited family planning coverage through New York State Medicaid program. However, I was not worried. I assumed I would be covered under my husband's health benefits through his employer. We then found out the premium to add me to his plan would be $100 a week. At that point, we were unable to afford the extra $400 a month. That was when I realized I was working full-time, married, and I was going to have to go without health insurance. That's when my health problems began to arise. I had developed constant bleeding and other symptoms that were consistent with those with ovarian cancer. For nearly a year, the symptoms continued until I finally became so ill that I developed anemia. I spent several anxious weeks filling out paperwork and waiting for an appointment for a sonogram. I knew I had to pay for it, and every form I had to sign along the way reminded me of that. The test came, excuse me. The test came back normal, but still did not explain the cause of the constant bleeding. That is when the doctor ordered a biopsy. The American Cancer Society helped me navigate this journey by helping me find doctors who would see me and figure out what I needed to do next. Fortunately, that family planning coverage, after weeks of investigating, would cover the biopsy. The doctor who does this procedure only came into the office once a month, and I had to wait weeks for an appointment, and an excruciating 6-week wait for the results of the test. The pain of not knowing the diagnosis was excruciating in itself, not to mention the fact that I was still suffering with the actual medical problems. However, after the longest 6 weeks of my life, I learned that I was, in fact, cancer-free. Unfortunately, my story does not end there. Being uninsured causes somewhat of a chain of reaction to future problems. While I was relieved at my diagnosis, I clearly still had some sort of problem that needed to be solved. A repeat sonogram was recommended to follow the progress of my condition, but I had to refuse the test because I could not afford it. An adjustment to my medication has helped, and it is covered under my family planning coverage, but a further follow-up is out of the question right now. I am still unable to enroll in a normal health insurance plan simply because I can't afford it. What I remember most about my experience was the waiting, the stress, the anxiety of not knowing if I was living with cancer, and every day I worried that I may always be without health care. What is worse is that I'm not alone. Some 47 million Americans are also without health insurance as we speak. I hope that a solution is found soon. Our country cannot afford to be without health insurance. Thank you.